Alright, let's talk about the sternoclavicular joint, which is this area right over here, obviously where the clavicle meets the sternum. And we just simply scratch through the thoracic outlet syndrome because that's not what we're talking about right now. Okay, so the first thing you might want to notice in regards to the sternoclavicular joint is how dense a fibrous joint it is, and also notice the relationship between the bony aspect of the clavicle over here and the sternum over here. And the other thing you should notice is this is the first rib, this little structure up over here, right there and there. So clavicle, right here, first rib, right in that area. So because it's so dense and fibrous, it takes a significant amount of force to injure this. Now, you can have a sternoclavicular joint injury where you simply just sprain the dense ligament over here. That's not particularly good. What your big concern is actually you can dislocate it either anteriorly or posteriorly. Your big concern is actually the posterior dislocation. Well, let's address the anterior dislocation first because it's really not all that big a deal, except for the fact you could miss it, at which point then you've got to explain to people later on that you're missing injuries, which is never good. All right, in regards to if you displace this anteriorly, there's not a whole bunch that's going to happen because here's all your vital structures over here, your nerve, artery, and vein. Here is your clavicle. And if you displace it anteriorly, all you're doing is increasing the volume in that area over there. Let's get rid of that for a second. On the other hand, if you displace it posteriorly, that's where you run into problems. This episode makes a little more sense. So your issue if you displace the sternoclavicular joint posteriorly is the vital structures on there, the nerve, artery, and the vein. Also keep in mind that there's not a lot of volume in here because, again, this is the first rib, this is the clavicle. There's not a lot of room in that area. So if you displace, we're looking lateral. We're looking basically from the side. This is your clavicle, right? And here's your vital structures, the nerve, artery, and vein, right? And you displace this posteriorly, you're not just going to contuse your vital structures of the nerve, artery, and vein, you're going to compress them and significantly injure them. And indeed, in addition to the nerve, artery, and vein, if you slam this up there enough, you can actually compromise the airway. Now, the treatment for this is to obviously reduce it. This is actually an emergency where it needs to be reduced as quickly as possible. And the treatment for that is to, let's do this, voila, is to actually take a pair of, you'll love this part, take some towel clips and you grab the top and the bottom of the clavicle at the area of the sternoclavicular joint. You bend the shoulders back like somebody's puffing out their chest, and you pull directly out using towel clips over here, and hopefully that should reduce the fracture. And that's one of those things that you should do if you notice any immediate compromise to the airway, and you should strongly consider if there appears to be any significant injury to the neurovascular structure. All right, so take-home points. Right? Again, start medially when there's an injury to the clavicle. Go laterally, and if you start from the sternum and work your way out, you will not miss an injury to the sternoclavicular joint, to the clavicle, or to the AC joint. Again, because of the nature of the structure over here, if this is anterior and this is posterior, you can have an anterior dislocation, which is not nearly as concerning as a posterior dislocation, because a posterior dislocation has significant concerns regarding injury to the neurovascular bundle and possibly the airway. So let's move now on to the clavicle.